In this video, I'm going to dig a bit deeper into why you get proximal hamstring tendinopathy, because I always feel if you understand the cause, and specifically the cause that's likely relevant to your case, it's much easier to choose the best treatment option, but also understand how to prevent it in the future. Then we'll look at the stages of injury and how that may affect your recovery. And lastly, I'm going to walk you through how we diagnose high hamstring tendinopathy, including the tests we use, and I'll also demonstrate those tests. For those of you who don't know me, my name is Marika. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of any type of sports injury, all done via video call. Now, I realize that sounds weird because shouldn't a physiotherapist be touching you to diagnose you or treat you? But because we've got the video, I can see you move, so I can get you to do all the same tests and things we would make you do in a physical clinic. And for most sports injuries, especially like high hamstring tendinopathy, treatments where you touch a patient isn't actually that effective. It's more about rehab. If you want to understand more about this process, have a look at the description of this video. I'll put some links in there. Let's do a quick recap of the anatomy first. Your hamstring muscles are the ones at the back of your thigh, and they have tendons at the bottom that attaches them around the knee and tendons at the top that kind of comes together and attaches right into the sit bone where you take most of your pressure when you're sitting. Now, you can get hamstring tendinopathy in the lower tendons as well, but that's called distal hamstring tendinopathy, and it's a totally different condition. If you want a video about that, have a look at the description of this one. I'll put a link to that there. So with proximal or high hamstring tendinopathy, it's the upper tendons that's affected. Now, what's also significant is to understand that your hamstring tendons work whenever you pull your leg back. So they help with hip extension, but they also help to flex your knee. But also in conditions like when you run, for instance, and your leg goes out in front of you, they work quite hard to slow the leg down. So any movement where you're walking, especially if you're going up hills or upstairs, or if you're running, if you're jumping, that all works the hamstring tendons. So why would you develop an injury like a tendinopathy in those upper tendons? Well, it's all about the normal cycle of tissue breakdown that we get with different activities. So whenever you work the body, and by work I mean either exercise it or just use it during the day for any task that loads it, you get little micro injuries in the parts of the body that you're using. And this is absolutely normal, and it's needed for the body to grow stronger, because that area that has the micro injuries then signals to the brain that, hey, this tissue needs to be made stronger. So in the period after you've done the activity, the brain then strengthens the tissue, but not just to the previous level, it actually makes it stronger than before. So if you allow this repair cycle to happen continuously every time that you've exercised or used that area, you grow stronger over time. Now, where things go wrong is if you don't allow that recovery time to take place. Because then what happens is, instead of the body gradually growing stronger, you're now exercising or doing the activity again before all the micro injuries have repaired. And then instead of growing stronger, you get that it actually weakens it and you get a proper injury in the end. Now, with high hamstring tendinopathy, there's two factors at play. It's not just using the muscles and working them. That, of course, can overwork them, but there's also the compression element. Because of how the hamstring tendons attaches to the sit bone, they can be pressed really hard against the sit bone, and that can overwork it in itself. Now, normal circumstances, the hamstring tendons are designed to take that pressure, and it's usually not an issue. It's again just if you overdo it. So if we think of the compression in that area when you're sitting directly on it, that puts pressure on it. But if you bend forwards, the more you bend forwards, the tighter those hamstring tendons are pulled over the sit bone, and the more compression you get. And often it's that combination of being bent over and working it really hard in that position that you then get, you're using the muscles, but also when it's maximally compressed, and that then predisposes you to this injury if you're not careful. So the three most common ways that we see people getting injured is, the obvious one is for people who do sport or physical activity, if they ramp it up too quickly or they don't give themselves enough recovery time. So we're thinking of runners doing a lot of high intensity running, fast running, uphill running. We think of cyclists because they're in that bent over position plus cycling really hard, which can really cause that. But also regular things like gardening. If you're not used to that activity and all of a sudden you're doing a lot of bending over and carrying heavy things, that counts as overtraining because you're ramping up your activity too quickly for the hamstrings to grow stronger and adapt. Another common one is overstretching. Now, bizarrely, a lot of people prescribe hamstring stretches for people with high hamstring tendinopathy. If you've been given those, please have a look. I've made a video about why stretching is really not the best exercise for this condition or treatment, and actually just makes it worse, because the problem with stretching is that you then really, when you bend the leg, when you bend your body forwards, when your leg is straight, you're wrapping that hamstring tendon right over the sit bone and pulling it tight. Again, this is not a problem if you're doing it in moderation, but if you're sitting in that position for a very long time and really pushing it, that can actually cause it to become injured if you do it too often. And if you're injured and you do that as an exercise, that can just, it's like pressing on a bruise, it irritates it further. But more on that in my treatment videos. If you want to see links to those videos, have a look at the description of this one. And then lastly, there's sitting. And this is a very common reason we see in people who don't do sports for getting high hamstring tendinopathy. It's typically, and there was a real spike in COVID, I found, because people were working from home. So what happened was they were sitting on really hard chairs that wasn't really meant for them to sit on for that long. And that direct pressure on the sit bone, irritating the hamstring tendons, they weren't taking enough breaks. So cutting off the circulation, not allowing it to recover. And then the hamstring tendon just goes, I'm overworked now. So sitting for very long periods of time can be a really big aggravating factor or cause for high hamstring tendinopathy. I've made a whole video about how you can use sitting as part of your rehab, because even if it wasn't the cause of your hamstring tendinopathy, it's often one of the things people find most uncomfortable. So have a look at the description of this video if you want a link to that one. I go through the whole process of why it's not a good idea to just avoid sitting and what you can do instead. There are also other factors that can predispose you to tendon injuries like high hamstring tendinopathy, because they affect the health of the tendon and make it easier to injure them. The first is genetics. Now, I know you can't do anything about your genetics, but if you understand it better, you can do other things to mitigate against it. So a common genetic variation that can predispose to tendon injuries is hypermobility syndrome, where the connective tissues, including the tendons, is just not as strong as in people who doesn't have it. If you're in any stage of the menopause, so perimenopause or full-blown menopause, the problem with that is that your estrogen levels drop when you enter the menopause. And estrogen is really important for collagen production. Now, tendons are mainly made up of collagen fibers. So when you're in the menopause, estrogen levels are low. It means that you just can't produce new collagen fibers as quickly and can't strengthen them as quickly. So if you now do exercise or activities that uses the tendon, you can't repair them that quickly. So it's always important to, if you notice that you're entering the menopause, you start just taking note of your body and don't try to stubbornly push through it, but rather understand how it's affecting you and just factor in more recovery time for yourself. Then thirdly, there's also some medications, and the most prominent of the medications that can affect tendons are fluoroquinolone antibiotics. Now, depending on the country you're in the UK, especially, they are quite good at it that they don't prescribe it that often at all. If they do prescribe it, it's only in cases where nothing else works. And that is because these antibiotics has been shown to be so detrimental to tendon health. Other countries, unfortunately, doesn't have such strict rules. And we see a lot of patients who end up with tendon injuries related to fluoroquinolone antibiotics. Now, we've made videos about them in the past. If you want to understand more about those type of injuries, have a look at the description of this one. And then finally, there's also your general health. Things like diabetes, thyroid problems, as well as really high cholesterol has been shown to influence tendon health and make them more vulnerable to injuries. So there's a real case to be made that if you're struggling with tendon injuries, do check that you look after your whole system, that you eat well, you exercise enough, which I know is a little bit hard if you've got pain, but there's always something you can do. And as part of what we try to do for our patients is figure out other ways that they can stay fit and healthy while they're recovering. I want to talk a little bit about the 3 different stages of a tendinopathy. Now, the significance of the stage you're in is just about how much change they see in the tendon when they scan it on ultrasound or MRI. It doesn't matter what stage you're in. Everybody can recover and get back to full pain-free function, but the stage of the tendinopathy can help set more realistic expectations for how long the recovery will take and also guide the treatment choice to an extent. It's not the only thing that determines what treatment will work. There's also things like the tendon sensitivity, etc. But it is one of the things that if we understand what stage you're in, that we know what treatments will more likely be needed. If we look at a healthy tendon, healthy tendons are made up of lots and lots of collagen fibers in parallel. Now, collagen is super strong stuff, and this parallel arrangement makes it even stronger. Remember that experiment from school where you have one piece of string and you can easily snap it, but they give you 5 and say, try it now, and suddenly it's really, really strong? Same thing with the collagen fibers. You also don't have that many cells in between. There's like a couple of cells that you can see on a scan. Now, the first stage of tendinopathy is a reactive tendinopathy. And this is usually the stage your tendon is in if it's only been sore and uncomfortable for a couple of weeks or so. When you look at it under a scan, you'll typically see that there's a bit more fluid accumulated in the tendon, but the structure is pretty normal. The tendon fibers are all nicely aligned still, and there may be a few extra cells in between, but not much going on in there at all. Now, the good news is, if you apply the right treatments in the reactive stage, it can calm down really nicely. And we're looking at the shortest period of recovery then, something like between 8 to 12 weeks even, if you apply the right treatments. And the best treatment at this stage is usually all about just reducing the load on the tendon, giving it everything it likes, and allowing it to settle down. Now, the worst thing you can do is start doing loads of rehab exercises or just continuing with your training as normal, because this tendon is now overworked. It needs some time to recover and just settle down. It hasn't lost strength yet. It's still got its beautiful structure going on there. So there's no need to start any strong rehab exercises. Yes, gentle exercise can be really, really useful, and a physio can help you understand what that is, but no strong stretches and no strong rehab at this point. I've done a full video where I talk in detail about load management and relative rest, because often it's better to stay active but just reduce the activities rather than complete rest. Have a look at the description of this video if you're interested in that one. If the tendon for some reason is continuously being irritated and not allowed to calm down properly, then it may enter stage 2 of the injury process, which is called the disrepair stage. Now, the important thing to remember here is that it's usually only a very small part of the tendon that's affected. It's not the full tendon that's affected. And you're usually in the disrepair stage when you've had your tendinopathy for a few months. Now, if you looked at it under a scan, you will see that the fibers in that area of the tendon has started moving away from each other a little bit, and there's more fluid in between the fibers. There may also be more different types of cells, but there's usually not any inflammation present at this point, and that's why anti-inflammatory medications don't really work for ongoing tendinopathies. You may also see some little extra blood vessels growing into the area. But the key thing to understand is that these changes are only affecting a small portion of the tendon. It's never the full tendon that's affected. What's the impact on recovery? Well, if you take measures and you start applying the correct treatment, so good load management, and in this case, allow it to calm down to a certain level, the pain and discomfort, and then start strengthening it up, because strengthening exercises stimulates the tendon to repair that area that's injured. The research shows that yes, your tendon can fully repair and it can look normal on a scan again, but it will take several months. So you're looking at a recovery period, if you're lucky, around 6 months, but more likely up to 9 months, and it can be a little bit longer. Again, I've spoken about all the treatments that can be useful for the different stages and in general for tendinopathies in my other video. Have a look at that if you're interested in that. Stage 3 has a really awful name. It's called the degenerative stage. Now, I hate this name because it makes it sound permanent, and that is not the case. Even if your tendon has entered stage 3, it's only a small part of the tendon that's injured, and you can regain your full pain-free function. We've helped several patients actually achieve that. If you've had your pain for more than 6 months, your tendon has likely entered stage 3 of injury. What this means is that if you look at it under scan, you'll see that portion of the tendon that's injured, the collagen fibers have now lost their parallel arrangement. So they're looking a little bit thicker and not quite normal. Also, you'll definitely see some little blood vessels and things growing into the area. What does this actually mean for recovery? Well, first of all, it's going to take a lot longer. So you're looking at a minimum of 9 months usually, but it's not uncommon to take up to 18 months even to recover. Also, that injured part of the tendon will likely also not ever look normal again on a scan. Now, that doesn't really matter. Think of how many scars you've got on your knees from when you fell when you were a child, and they don't give you any trouble. So just because something doesn't look 100% normal again doesn't mean that it's going to be injured forever, and it doesn't mean that you're always going to have trouble with it. The thing with collagen is that it's super strong stuff, and similar to muscle tissue, if you train it and you give it the right mix of rest and exercise, collagen can grow stronger and your body can really produce more collagen fibers and strengthen them. So in this stage of injury, it's all about getting the rest of the tendon to grow strong and healthy so that it supports the area that doesn't look normal anymore. So the best treatments for this stage of recovery is a mix between things that allows your pain to calm down if your tendon is very sensitive, and then also careful reloading so that we're building that strength in the tendon up. Now, this can be through specific exercises, but for some people, exercises don't really work. It always just makes them worse. And for those cases, it can work really well to use general activities to actually build their strength up. So there's loads of ways to go about this, and an experienced physio can help you with that. I also just want to say 2 things about pain at this point, because it's quite common for people to think, oh, I've had such high pain for such a long time that my injury must be really serious. Now, what the research has shown us is actually there's very little link between the severity of an injury and the intensity of pain. Yes, injuries cause pain, but your pain can be dialed up sometimes that it's causing a lot more pain than what the injury actually looks like. Or it can be dialed down that actually your injury looks quite serious on a scan, but there's nearly no pain. So pain is a subjective thing that we can dial it up and down depending on what's going on in our minds, but also in our bodies. And from the research, we know that things like if you've had pain for more than 3 months, the body becomes better at creating pain, so it dials it up. Also, if you've got high stress levels, either through work or through social life or just family life, that can dial pain up. Equally, bad sleep, or if you're feeling ill, or if you're feeling very pessimistic about recovery, all of those things have shown to dial the pain system up. But the good news is also you can dial the pain system down if you understand how it works. And I've written a detailed article, and I'm about to make a video about that as well, about how the pain system works and how people can help calm it down if they need to. So have a look at the description of this video if you're interested in that. Okay, so let's look at how do you know if you've actually got high hamstring tendinopathy. Now, doctors or physios, regardless of whether you see them in a clinic or actually online, will make the diagnosis in 3 ways. The first is they will have an in-depth conversation, because depending on what you say your symptoms feel like, how they act to different activities, etc., that can give us a big suspicion of whether this is hamstring tendinopathy or not. And I'll walk through that in a minute. Then the second is you have to combine that with movement tests, because sometimes you get information from the conversation you're having, and then when you do the movement test, you realize, no, wait a second, this doesn't match up. And then lastly, you may also need to use scans, but scans are usually not needed for this condition. You can usually make the diagnosis just through the in-depth conversation and the movement tests. But if there are other things that's just not as clear or making you think maybe there's something we need to rule out, a scan can be quite useful. Let's dive into each of these in more detail. So some of the clues we're looking for in the conversation we're having is, first of all, how does your symptoms feel? So typically for a tendinopathy, you're expecting the person to say that it feels painful or that it feels quite tight or stiff. Sometimes they have both those symptoms, but some people may just have pain, others may just have stiffness. If they're getting tingling or numbness or funny sensations in their leg, then that's a sign that there's actually a nerve irritated. Now, it may mean that it's a totally different injury, or it may actually mean that, no, they have got high hamstring tendinopathy, but a nerve is irritated in addition. And your physio will understand what tests to do to test for that, to understand what exactly is going on. Then it is also about where you're feeling these symptoms. Now, typically, the main pain with high hamstring tendinopathy is right in the sit bone. So right there where you would sit. If your main pain is more up here, that's likely going to be more a glute or back injury. Same for if your main pain is more in the back. It's also normal for high hamstring tendinopathy to have tightness and stiffness and a bit of pain into the hamstring muscles themselves. But if the pain is going below the knee, or especially if you've got numbness in the foot, then that's going to be more related to a back injury or nerve irritation usually. Like I said, it can be both of them at the same time, but it may also be that actually your diagnosis is not high hamstring tendinopathy. Another thing we're very interested in is to understand how your symptoms started. Typically, a tendinopathy will start slowly over time because it's an overload injury. If you had a sudden sharp pain or incident and then your pain was there, that usually means you've torn something, not a tendinopathy. So with a tendinopathy, it's either during a hard training session or a day of gardening or something like that, that suddenly towards the end of that, you start thinking, oh, that's becoming quite uncomfortable. But more typically, it's actually hours after you've done the activity, or even the next morning that you wake up and think, oof, what is going on there now? And then lastly, we want to understand how these symptoms react to different activities. Typically for a tendinopathy, they either have a delayed pain response, so you don't feel the pain immediately while you're doing it, but several hours later it becomes uncomfortable, more uncomfortable after you've done something, or they feel really uncomfortable at the beginning of an activity, but then they warm up and it feels okay, like you can do your run and it's not too bad, but then if you push it that a little bit too far, the pain comes back and it can be a lot worse afterwards. So you've got that combination of sometimes the pain disappears, sometimes it comes back worse, and more commonly, it has a delayed pain response several hours later. And especially with stretching, that can be the effect. So any movement where you've got, let me just demonstrate this. So any activity where you bend over and you pull that hamstring tendon even tighter over the sit bone will be more aggravating than when you're upright. So that means that anything where you work down there, or where you do exercises like deadlifts, where that really pulls tight, or even a squat where that really pulls tight. Or if you're doing a typical hamstring stretch where you're sitting with your legs straight out in front and you're bending forwards, that can really irritate it. But like I said, often it doesn't feel painful in the moment. It's only several hours later that suddenly your pain flares up and feels much worse. And then, of course, there's sitting as well. So some people will find that if they sit for a short period of time, it can be really, really painful, while others can sit for a very long period of time before it even starts to hurt. Some may find that it only hurts if they sit on certain types of surfaces. It all just depends on how irritated that tendon is, and also the specific area of the tendon, whether that actually makes contact while you're sitting on it. If that's the injured part, then it's more likely to hurt. Okay, next we've got the different tests you can do to try and confirm whether it's high hamstring tendinopathy or not. The first thing you can do is, yes, you can press on the injured tendon and see if it hurts, but actually that's not a very accurate test because of how the tendon attaches to the sit bone. You may not be able to actually reach the part that's injured. And it will also be positive if the bursa is sore, for instance. So just because you're pressing on it, it doesn't hurt, it doesn't mean that it's not high hamstring tendinopathy. Now, the more accurate test that you can do is actually movement tests, where you move the tendon into specific areas or you contract the hamstring tendons or the hamstring muscles to see how that affects the tendons. And these are the tests we use for our online consultations as well, because just like I'm now going to demonstrate them in front of the camera for you, we can demonstrate them over video call and then observe the patient before performing them. There are three main tests that people use. There can be more and others, but these are the main ones that people use to diagnose this condition. And you want to usually start with ones that doesn't cause a lot of compression on the tendon. just because it can be so easy to flare it up. And then if you don't really elicit symptoms with those, you tend to move on to the ones that compresses the tendon a little bit more. So I'm going to run through them for you. The 3 tests we're going to look at are bridge variations, also deadlift variations or Romanian deadlift movement. And then lastly, we're going to look at a hip flexion test that you can do to really compress the tendon against the sit bone and see if it hurts there. Now, please remember that tendons don't always tell you in the moment that they're going to flare up and going to be painful later. So if your patient told you in their conversation that their tendon pain can really flare up with certain movements, keep that in the back of your mind and perhaps don't test it to the point where you actually elicit pain. Just get a good idea of their strength and their movement to the point where you think you've got it figured out. Because if you do too many tests in that first session, you can really flare it up. I will say from a patient's point of view, I'm really sorry, but even if the physio is really careful with how much they test and how they test it, it's not an exact science. You can't get it right perfectly, and you may likely get a flare-up of pain the next day. That pain will settle down quite quickly within a few days of giving it relative rest, and it is unfortunately part of the process of figuring out what exercises are correct or not. If you do get a painful flare-up, don't just ignore your physio and never go back to them. Tell your physio about that, because that will help them better understand your situation and better tailor your rehab exercises. Okay, that's a lot of talking, so let's move on to the first test. We're going to look at the bridge, and we're going to look at a bridge that doesn't put a lot of compression on the tendons because it's the least likely to aggravate you. And this is a good place to start, especially with people who have really sensitive tendons or who doesn't do a lot of exercise, or maybe they've just had a long period of immobility or not really doing much, so they're not going to be that strong. If you have an athlete who is really strong and doesn't sound like they've got an irritable tendon, you can start with stronger versions of the bridge. But let's start with the basics. So for the basic bridge, you've got your feet quite close to your bum, because in this position, the hamstring's not going to work that much. It's actually going to be your glutes that does most of the work. And that's exactly what we want. So all you do is you tighten up your tummy, squeeze your bum gently, and just lift your bum off the floor. And honestly, you don't have to worry too much about where you feel things working. If you're lifting up, the muscles we want to work is working. What we just don't want to see is this going on, because then you're using your back muscles more. You just want to go to where your hips go pretty much straight. And all you're doing is observing, what do you feel? Now, for some people, that may already cause a bit of discomfort in that area. And that would mean that this is likely where we're going to start. We're not going to even continue testing in the bridges. If it doesn't cause any symptoms, you can make the bridge a bit harder. Now, there are plenty of ways to make it harder. One would be to move the feet further away. The further your feet is away from your bum, the more the hamstrings are going to work. So you may even lift up on your heels, which activates the hamstrings more, and see if that causes trouble. You can also go and do it on a single leg, or you can put a weight on there and do it up and down, or you can put your feet on a chair to do that. I have made a video in the past about bridge progressions. I'm going to link to that one so I don't make this video too long. If you want to know the harder versions of the bridges, go look at that one. But like I said, start with the basics to test it and see how that influences it and build up from there. Okay, so the Romanian deadlift can be a really useful movement to assess the high hamstring tendons, because what happens is you're going to bend your knees ever so slightly, and then you're just going to hinge forward from the hips. And what's happening here is the hamstrings have to contract while you're bending your hips, so the tendons are being compressed gently against the sit bone. If they are injured, this movement very likely is going to hurt. And most people can only go to parallel if they've got really flexible hamstrings. If you're really tight, you may only be able to go to that position. Get the patient to do that, see how it feels. I find it useful to tell people to guide the movement with their hands to about there. Now, if that doesn't cause any trouble, you can make it harder. So you can hold something heavy, because that will load the tendons more. You can also do it on a single leg. Then you've got a balance element coming in. If you don't want to, because being off balance can add an extra element. So I often get people to just have a hand on a wall first, and let's just see what the extra load is doing to it, rather than have the balance there. And then, of course, you can test it like that as well. So that can be a really useful one as well to do. And also what I will do is if somebody has a really sensitive tendon, I may not get them to go all that way down. So often I use it to just see, say for instance, I've got a really, really painful tendon. I'll get them to just go to where they can start feeling it pulling. And we note how far the fingers are from the knee. And we use that as a measure to remeasure when they start to feel better. Because the other thing is, often with high hamstring tendon patients, they've had pain for such a long period of time that everything is super sensitive. And every sensation you feel in that area triggers the mind to think, oh, I can't do this movement because it's going to make it worse. And often I will get people to pause and just ask them, what is it that you're feeling? Is it pain or is it just a pulling sensation? And 9 times out of 10, it's just a pulling sensation. And it's just your system that's so hypervigilant that it's saying, no, we can't do it. We're feeling something there. And it's absolutely fine to feel something there. We just want to keep the discomfort we feel below a mild niggle. So, or a 3 out of 10 people sometimes talk about. So don't be frightened if you feel something. We need to understand what you're feeling so we can use that then as part of your rehab and slowly use that movement to improve it. But I will go into detail about that in the rehab videos and the treatment videos as well that I'll make in the future. Have a look. There's already some articles I've written about that, which I'll link to in the description of this video. The third test is the bent knee straight leg raise. Now, that's a contradiction. Let me demonstrate this to you. So normally, when people test the hamstring tendons, they will get you to lift a straight leg up into the air because that stretches the hamstring. Now, the problem with that is it tends to get the hamstring more at the bottom or in the muscle belly. Whereas if instead of that, you have your other leg straight first and you bend the leg you want to test up first, can you see that you're now already putting some stretch on the upper tendons, getting them into contact with the sit bone? And now you're straightening out your leg, which means you're pulling it even tighter. And you can even then pull back a little bit there. If the hamstring tendons are injured, usually this will cause them to feel uncomfortable. If you've got a band that you can put around your foot, you can even increase that more. Now, I am quite flexible. If you have tight hamstrings, you will not actually be able to get your legs straight. And that's absolutely fine. So what I would do is bring it into flexion so that you've got your knee into your chest, and then straighten it as far as it will go that your hamstrings allow. But try to keep your hands there that you don't just do that when you straighten it. So that's where you want to get it. And that will usually tell you if the hamstring tendons are angry or not. Now, please remember, that is a test. It's something you do at the start to understand whether you've got high hamstring tendinopathy or not. It's not something you do as a treatment. And if you're going to test it every single day, it's like pressing on a bruise. You're just going to keep the pain going. So I often get patients with shoulder injuries that says, when I do this, it really hurts the shoulder. And guess what they're doing all day? They're doing this all day, and then it doesn't get time to calm down. That type of stretch is exactly the same thing for high hamstring tendinopathy. Don't go and test it every 2 seconds because it will just keep on irritating it. Okay, it's just a test you do for diagnosis. None of these tests are 100% accurate. That's why you can't just do one as a diagnostic test. You've got to do a couple and marry the results up with what you found out about the symptoms as well, and make sure that they match. Because if the symptoms don't match what you see in the testing, then it may actually be an indication that you need scans to further diagnose this. So scans can be really useful, especially if the diagnosis is not clear, but they're not always needed. Most of the time you can diagnose it, or experienced physio can diagnose it actually through really listening to how the symptoms are acting and marrying that up with the tests. The nice thing about the tests is also it doesn't tell you just about the diagnosis. It also tells me as a physio which exercises are most likely going to work for you, how sensitive your tendon is to certain positions, and what's the combination of rehab we are most likely to start with that won't flare you up. But like I said in the start, unfortunately, it's not always possible to create an exercise plan the first time round that 100% won't flare you up. It's quite common after you've done all these tests to have a bit of a flare-up the day after. If you experience that, tell your physio. It will help them make a better plan for you eventually. Brilliant. Hope you found that useful. Now, if you've got any questions, just ask them in the comments. I've also made videos about treatments and how to use sitting for rehab, specific videos for runners, as well as how to adapt bridge exercises. So have a look at those as well. I'll link to the playlist in the description as well. And if you need more help with an injury, you're welcome to consult the team via video call. Link to the website is in the description of this video. Take care.